Hey guys, Dr. DenBoer here. I am doing a TikTok from a different angle. Again, this is not meant as medical advice. I'm not a licensed professional. Love doing these videos and appreciate your comments. Glad to have my voice back. I am doing a TikTok here on the dangers of loneliness in older adults. So there's a lot been written about this, but there's a real interesting study on loneliness that was done from the Harvard School of Public Health. And basically what they said was that loneliness affects 25 to 60% of older Americans, and it puts millions of Americans 50 and over at risk of poor health from prolonged loneliness. So they also found that loneliness is as prevalent as obesity. So they surveyed these members of AARP Medicare supplement plans. Long story short, these are plans that are issued by people like United Healthcare, as well as Cigna and other Medicare Advantage plans. And they found that 27 to 29% were actually suffered from loneliness, and then about 9% were severely lonely. And they also found, and again, I'm taking this from the Harvard Medical School of Public Health, but they found that among members representing the top 5% with the most chronic conditions, loneliness rises to 55% of that population for the top 5%, and then half of whom, so about 25% of that, suffer from severe loneliness. So if you take the 5% of the most lonely, then that makes up 55%, or among that class, there's 55% of that are significantly lonely or severely lonely. And this is the factor that I find to be most incredible. They found that loneliness was the equivalent of smoking 15 cigarettes a day, and this shortens one's lifespan by approximately 8 years. So when they did this longitudinal study from the Harvard Study of Adult Development, they found that the 75-year longitudinal study, which is a really, really long study, they found that loneliness is a very toxic development. It's severely toxic. So they found that, in addition to the equivalent significant loneliness is the equivalent of smoking 15 cigarettes a day, they found that the more isolated people are, the less happy they are, and then brain functions decline as well as physical health. So they found that isolation, typically, they define this as the objective measure of how large their social network was, whereas loneliness was really the subjective perception of how somebody feels. So they could have a larger social network, they could feel disconnected from that network. And they also found, again, a really interesting finding here is they found that loneliness can spread like a cold. So according to a recent study, which was called Alone in a Crowd, the structure and spread of loneliness in a large social network, they found that lonely people tend to share their loneliness with others. So they found that there's a social contagion associated with loneliness. And over time, there's this group of lonely, disconnected people. They move to this outer fringe of this social network, and they found that this is compounded because lonely people, especially those in the periphery, tend to lose the few contacts that they have because they bring such negative, I guess I would say, energy or negativity to their relationships. So what could we do about this? So fortunately, there's been this campaign in in the UK in general, to end loneliness. And they found that more than half of lonely people simply miss having somebody to laugh with or to really talk with. And this is really an epidemic among older people. So they found that simply being together with somebody is missed. Just the physical presence of being with somebody and the energy that curtails is missed by all people, 52%, and 46% miss having some physical contact, like a hug. And they found that older people experiencing loneliness also miss simple everyday moments. And this is really heartbreaking when you think about it, such as sharing a meal, 35%, holding hands, 30%, taking walks in nature. 32% are going on a vacation. That's 44%. So they talked about these things in terms of social connection. I started a not-for-profit company called GrandPal that tried to bring people together to reduce social loneliness. So there's a variety of different apps and other things that you can use to reduce loneliness. One is called Connect to Affect, AFFECT, and that's sponsored by the AARP Foundation. And their goal is to create a network that builds awareness regarding social isolation and its impact, and also identify solutions. So I thought that was really cool too. Again, as we come up on the Thanksgiving holiday and we appreciate the social connectedness that we all have, that we are all grateful to have. For those that have it, remember those that are disconnected and try to reach out to them socially. For those caregivers that are out there that are feeling disconnected, even though we have people around them, again, you try to reach out and have active connectedness, maybe using these measures, and reach out to those social connectedness networks that you might have, including this Connect to the number 2 Affect, Connect to Affect, through the AARP Foundation. Hopefully this is the beginning of something that helps, and hopefully you found this information rewarding. Thanks again. Take care and have a great day.